If the state fails to act now, the impacts will be immediate and devastating.
Santa Clara County Supervisor Susan Ellenberg with that warning to Governor Gavin Newsom and state lawmakers about the governor's $350 billion proposed state budget.
Every single county.
Ellenberg, who also serves as president of the California State Association of Counties, spoke alongside other county leaders from across the state concerned the proposed budget does not do enough to offset federal cuts from the Trump administration's H.R. 1 law, or as President Donald Trump has described it,
the great big beautiful bill.
California's 58 counties estimate H.R. 1 will result in about $9 billion in cuts to key safety net programs they help run, including CalFresh food aid and subsidized health care for more than 15 million low-income Californians on Medi-Cal, with some estimates showing H.R. 1 could result in at least 1.5 million of those Californians losing their coverage. Without further state action to help offset the cuts, officials warn the healthcare system could be severely impacted.
Longer emergency room waits, reduced access to care, and a deeper strain on local governments already stretched.
And she's concerned counties will continue to be stretched under Newsom's budget proposal. To help backfill the federal cuts, counties asked Newsom to allocate $1.1 billion for them, but they say his proposal will result in counties receiving much less, $87 million to be exact, about 8% of what they say they need.
That is just not acceptable.
The possibility of nothing being done, in my mind, is unconscionable. The budget, of course, has to be balanced, but it cannot be balanced on the backs of poor people.
Number one crisis that is coming to our communities.
Inyo County Supervisor Jeff Griffith says rural hospitals in remote communities like his are especially at risk and could close due to H.R. 1. All the more significant in regions where only 1 or 2 hospitals exist.
In our rural, remote areas, there's no other hospital to go to.
Dr. Ilan Shapiro of AltaMed Health Services putting it bluntly, if the H.R. 1 cuts move forward without more state assistance,
our patients will suffer, create a wave of people that will get sicker faster with more complications.
But during his budget presentation last week, Newsom fired back at counties, saying he's prioritized local governments coming up with new ways for them to secure more revenue. He argued President Trump is the one leaving counties behind.
Trump hardly has our back. But the abundance of support we provided to the cities and counties and across the spectrum of issues in the last 4 or 5 years is pretty significant.
And as for his side, President Trump has said H.R. 1 will help eliminate wasteful spending. Meantime, the governor and the legislature have until June 15th to negotiate and pass a final budget agreement. At the state capitol, covering local news that matters, Eitan Wallace, Fox 40 News.